Let's say my infant is having a severe choking. A severe choking is when there's no air movement between the lungs and the atmosphere. Remember, a severe choking, they cannot cough, cry, yell, babble. They might not be able to do the universal sign of choking, which is hands on throat, elbows up. Instead, they might reach out for help, eyes in distress, and you know something's wrong. I would start off with giving them a couple back slaps to see if that clears out the obstruction or the baby's able to babble after that, cry, whatever. If there's no implication that the baby has cleared the airway, your next step would be to scoop him up, cup his face like so, let his leg straddle your arm, and then I'm going to go ahead and lower the baby's head lower than the body. Notice how I'm using my leg as support to hold the baby's weight. Now with the base of my palm, I'm going to go ahead and give 5 back slaps to the middle of the back, upper back area, center back. 1, 2, 3, 4, 5. If I don't notice the obstruction coming out, if the baby isn't crying, then my next step would be to continue to give 5 chest thrusts. So I'm going to grab the head like slow, flip him over to my other leg or thigh, and I'm going to have his head lower than the body. Now using 2-finger method in the center of the chest, I'm going to go ahead and give 5 chest thrusts. 1, 2, 3, 4, 5. If at any point I notice the obstruction, if I visually can see it, I'm going to use my pinky and scoop it out. However, if I do not see the obstruction, we don't want to go in there and do a blind finger sweep because we could further lodge that object deeper in the airway, and we don't want to do that. If baby's still not crying, no obstructions come out, I'm going to cup the face, flip them over, and continue my treatment, giving them 5 more back slaps. You got to be firm, get that obstruction out, and still nothing. I'm going to go ahead and continue my treatment.